a more efficient and effective health system is something I support. However, the lack of an opt-out system represents a major breach of the rights of privacy and could risk the safety of our community's most vulnerable. It is deeply concerning for many Victorians, including victims of domestic abuse, violence and stalking, to name a few. A mandated data system could risk victims and their children being exposed to their abusers if they were to gain access to this information. Implementing an opt-out system upholds the principle of patient autonomy by giving patients the choice to decide who can access their health information and how it can be used. The right to privacy is paramount. The erosion of this right risks Victorians disengaging from our healthcare system in fear of their safety or in fear of how their information could be used. And this could result in Victorians avoiding critical medical services which they really need. The neglect of our right to privacy is significantly troubling given recent events in the health industry. While those opposite will cite the perceived improvements to data protection in this bill, we cannot ignore the increasingly dangerous environment that electronic databases are facing. In recent months, Australians have been aware of major threats that the IT industry faces when it comes to databases, notably through the hacking of Medibank and Optus. In fact, the UK's National Health Service was last year involved in a major ransomware attack. This concerning pattern of attacks has unfortunately been the topic of many conversations with my constituents. The Law Institute of Victoria, which is the peak body for the legal industry in this state, has expressed grave concerns regarding the Andrews Labor government's refusal to include an opt-out system. I refer to the Law Institute of Victoria's media release from the 15th of February this year, and it says this: patients must have the right to say who can access their health information, even if this means their health information will not be shared under this scheme. Patient autonomy is a fundamental human right. It's the same principle that allows patients to refuse medical treatment. Just hours ago, the LIV, in partnership with Liberty Victoria and Digital Rights Watch, reiterated its call for patient autonomy to be respected and described this bill as a departure from a human rights and patient-oriented framework which is well established in other Victorian legislation. I'm also worried about the government's exemption of the freedom of information requests in this bill. This provision prevents patients from requesting information on who has accessed their health data and why. The Law Institute of Victoria President Tanya Wolff said the following: such a provision leaves patients in the dark on how their health information has been accessed and by whom. My constituents are calling for an opt-out system. The Law Institute of Victoria is calling for an opt-out system. Therefore, I am calling for an opt-out system. While I agree with the intent of this bill to improve the health outcomes for Victorians, I will not stand by while the principle of autonomy is yet again trashed and neglected by this government. Thank you.